Yes, I guess we're both excited tonight. It's the COVID update show. What's up, Nikki Barron?
Oh, not too much. Just spending my evening reading all about the eviction moratorium, which is the topic of today's show.
Yeah, today's show is about the eviction moratorium, and it's actually, like I said, this is timely and useful information for our community. I know I look crazy out here. I'm used to my A1 lighting, but we're making it work on the fly. But this eviction moratorium is important. There's so many people that I personally know that are months behind on their rent for one reason or another, all COVID related because it's their job and their income and everything else. And up until maybe a week ago, they didn't really see any light at the end of the tunnel, and we were talking about an eviction tsunami that was on the way. So this program that the King County Courts is talking about can really stave off these evictions and hopefully keep people in their homes.
Yeah, hopefully. But we'll get more into that. Let's jump right into the numbers for today. So we've got the numbers here. So I just got these. They were updated around 4 o'clock today. So if you watch the morning update show, these numbers are going to be a little different. So confirmed cases are up. So we have seen an increase of 3,126 cases since yesterday. And for reference, we had about 2,100 from the day before. So the numbers are increasing daily. Hospitalizations are up 34 hospitalizations. And for reference, yesterday it was up 25. And we lost 45 more Washingtonians since yesterday, and the day before that was 31. So they were able to update the test positivity rate as of 11/20, and it is 15%. So it was almost 11% last time we checked in on the November 18th. So we're up to 15%, and for reference, our goal is a 2% positivity rate. So it's not looking good as far as the numbers go. And this morning, you actually asked me a number I didn't have, and that was hospital readiness. So percentage of beds, and I actually found that we do have a dashboard where we can see that. So what we can see here for Washington State as of today, we're at about 73% capacity, so we've got some room there to basically accommodate this increased number of people who are being hospitalized, but that's pretty high. 75% of the hospital beds being full is not a good number.
So let me stop you right there then, because I had actually misinterpreted what you said. That number, the 73 or 75%, that's at the capacity that's at right now, or that's what's available?
Let's just pull it up again, just to double check so I know that I'm giving you guys the right number here. Yeah, so the Department of Health defines adequate capacity as having less than 80%. So yes, so the way I'm reading this is that we are at 73%, and as long as we stay under 80%, we're in a good place. Yeah. So, but thanks for asking and clarifying that, because it is kind of written in a confusing way.
Yeah. Well, usually this health information is, and that's why we have this coronavirus update show, because some of the information is, from the scientist standpoint, it's very straightforward, but not everybody speaks scientist. And so we got to break it down into a layman's sense. And it's crazy because even from this morning, I believe this morning, that the total number of deaths last 24 hours was in the 30s, and then it was already a jump between the morning show and the coronavirus update show. It's just 6-hour time difference between those shows, and you had another 15, 16 deaths reported.
Yeah, so it was 31 deaths yesterday reported, and today it was 45. So it's increasing, and if things keep going the way that they're predicting, that's only going to continue to get worse. Another number that you guys might remember, we had actually referenced this before, and that is the event risk assessment tool. And I actually have that number as well. So for King County, our current risk, so the way this graph works is if you are in a group of 10 people, right now the risk that somebody in that group of 10 people has COVID and could pass it on is 26% chance that somebody in the room with you has COVID if you're in a room of 10 people or less. So it's a pretty scary number to think about, like somebody in the room right now might have COVID. So we're just pushing through and, mask wearing, washing your hands, and social distancing whenever possible. So that's where we're at.
Man, I mean, it's a broken record, but it's a record that continues to be heard because a lot of that isn't really. Well, I would say this though: City of Seattle, it's a city that I live in, I operate in. I mean, I'm downtown a lot. I hardly ever leave the actual borders of the city. I really see a lot of compliance within the city of Seattle. 100%, man. Like, and sometimes when I'm walking over here from my house to the studio, I just count to see, like, who do I see not wearing a mask? And a lot of days, it's 100% on what I see. And so it's like, it's real interesting to me is to, like, man, where is this rise coming? Clearly, I'm not around all 700,000 people in our city. But, even when they put up the stats, Seattle has the municipality of Seattle has the lowest coronavirus infections or every category from the top 30 biggest cities in America. And so, like, people within this actual city limit seem to be doing what they're supposed to be doing. Like, where was this rise coming from that's pushing these numbers? I know you talked to someone about South King County, but, like, what's going on in the rest of the state that's driving these numbers? Because I feel like people in the city of Seattle are really doing their best to stay compliant.
Yeah, so I actually just read a study that King County Transit did, and they found that they have about 83% compliance for riders in the transit system the last time that they did a randomized test. So that's still pretty low considering that it doesn't, 26% of somebody say there's 10 people on a bus that there's a 26% chance that one of those people has COVID and is spreading it. So I think it's, like maybe in the downtown core, you're really seeing it because people are really big on like calling it out. I know I've seen people doing that on the streets, especially if people wear the mask like below their nose. I'll see people be like, hey, like that's supposed to be over your nose. I'm starting to see signs around in restaurants and stuff that say like, this is how you must have your mask on when you're in here. So I think people are starting to understand that it's not just wearing the mask, but wearing the mask correctly. It's washing the mask and making sure that mask is a double ply, so at least 2 pieces of fabric. But I mean, we are kind of in a bubble. And there was also a study recently that they did where they talked about areas of the state and messaging. So they found people who were on the other side of the state. They're more inclined to listen to something called a health plan or something that's a little less mandate. So when people heard the term mandate, they were less likely to follow the mandate. When they were presented with this idea that it might be a health plan or it might be a stay healthy, kind of more positive, like this is something we're doing, it's a choice we're making, it's not being mandated, they're more likely to listen. So there's actually been a lot of studies now talking about how the messaging can help increase that number of compliance when it comes to masks. But I agree, I don't know anybody not wearing a mask. Occasionally I see that wrong mask thing, but yeah, right. Just in a bubble.
Yeah, people get called out about it. Hey, pull your mask up.
I know I do it. Like if I see somebody having their little nose poking out, I'm like, no, you got to get that up.
I know you will. You don't be playing. You don't be playing. All right. No. What else you got for us? Or are we going into our video?
Well, I just wanted to talk a little bit about what the mandate actually is. So I think that because it's kind of been morphed and changed a little bit, I just wanted to review kind of what the mandate means. So essentially what the mandate is it's for renters, not for people who hold mortgages. And essentially it says that you cannot be evicted because of non-payment during this. There's a couple of different loopholes or exceptions. One of those exceptions is if the person who owns the home intends to sell the house or move into the house, you can be evicted with 60 days notice. So that's what we're seeing currently. They're talking about, and people have been advocating for another, which is that when we get past this this period that we're talking about here, that we're going to do the interview about, where people can actually come to the table and discuss coming to an agreement. Once we get past that, they're talking about making it required to prove that you were unable to pay rent due to a COVID-related loss of income, which can get really tricky, especially for freelancers, people who have second and third jobs. It's going to be a pretty sticky situation. So that's why this program that we're about to talk about is so important. So I wanted to bring up the statistic to give people a sense of how big this problem really is. So at the end of October, more than 500,000 renters in Washington were using credit cards or short-term loans to meet their basic spending needs. And I think it was over 170,000 had not been able to pay rent for the last 3 months and were confident they could not pay rent next month. So it's a lot of people in the state of Washington that are gonna need to go through a program like the one that we're about to show you guys.
Well, I'm just glad that the state and the courts have got out in front of this. We've been waiting to see, unfortunately, kind of from the sidelines, waiting to see what was going to happen with a potential eviction tsunami. So I'm excited to hear more about the program.
All right, yeah, we're going to jump right into it. This video, you might see a small delay because I am playing it from YouTube. So I just want to let you guys know. You can also find this entire interview live right now on YouTube if you experience any problems. But here we go.
All right, so we're gonna come in. No, this is the best thing. You know the best thing, Nikki Barron. No, I see people like, hey, audio off. The best thing, Nikki Barron, is about converged viewers and converged supporters. Like they don't be ready to throw us under the bus. So it's a different kind of problem that other people have. It's all right. So we're gonna restart again. There's a button that we needed to push on our side to get the audio. So we're gonna play it again with that button pushed.
For this to not go smoothly. So fair warning. Hopefully this time around we've got it.
Our viewers love us. Don't worry. We're gonna play it again.
Here we go. Thanks so much for joining me, Commissioner Judson.
Thank you. Pleasure to be here, and thank you so much for giving me the opportunity to talk about this eviction resolution program.
Yeah, so why don't you walk us through what exactly that is?
Okay, well, the Eviction Resolution Program in King County is a program designed, it's a pilot program for the time being, and it's designed to give folks, landlords and tenants both, who are having problems due to COVID and the effect on the economy regarding non-payment of rent, to give them an opportunity and a structure to come together in a mediation setting and try and resolve those issues so that, when the moratorium lifts, everybody won't be coming into court and trying to commence eviction cases.
So can you talk about what that process looks like, who starts it, and kind of what the steps are?
Sure. At this point, there are two stages: the pre-moratorium lifting and after the moratoriums have lifted. Right now, it is a voluntary program, and it started by the landlord providing a notice. It's like a 10-day notice to the tenant, expressing interest in and essentially offering, inviting the tenant to join them in this process and scheduling a mediation session. They're handled by the Dispute Resolution Center, King County, and there are staff attorneys available from the Housing Justice Project, volunteer attorneys. There is no cost to anyone for this process, and free interpreters are also available if needed. But there's a notice that goes out, and if the tenant doesn't respond to that, there's a second 10-day notice that will go out. That the DRC representative, they are all trained, call them eviction resolution specialists, they're all prepared to try and contact the tenant directly to encourage them to come and take part in the process. And again, the hope to resolve any outstanding non-payment of rent issues in a context that will allow people to sort of think outside the box a little more than going into court, and just with the rather limited remedies that are available in that kind of setting.
And part of this process and part of what this mediator can do is actually help the tenant find resources, correct, for paying this. So it's not just, oh, I'm going to have to eventually pay all this. There's programs and funding that these specialists can help people tap into, correct?
That's absolutely right. Yeah, they're the simpler aspect of it, theoretically, to develop a payment plan to take care of any back rent that's owing. But there are rent voucher funds that are available. There are all kinds of other possibilities that options that are available that frankly would not necessarily be available as easily in a court setting. And so, yeah, the opportunity, I think, for both landlords and tenants here is significant, and it is designed really to help both sides. The whole program came together really as a group of sort of across the board. There were some judicial officers involved. I was one of them. There landlord groups, tenant groups. So it really got the blessing of all of the involved parties.
You mentioned that this is a pilot program. Is there a cap on how many people can participate, or any, like limits here as far as participating in the program if you're a landlord?
Not that I'm aware of. I don't know how many eviction resolution specialists that they are prepared to field, but I have not heard that there is some cap. The cap really is a monetary cap because the funding for the program came from the CARES Act, and that will terminate on December 31st. There are plans in the works, and I think it's happening right now, to seek additional funding, both federal, state, local level, to try and keep the program going. Just because from the court's perspective, court is trying to avoid what you hear about, the quote unquote eviction tsunami. And of course, nobody wants people to be evicted.
So is this a program and process that can only be initiated by landlords, or if you're a tenant, can you apply and this process go the other way?
Certainly in the voluntary part of the program, I think either party can do that. The court's involvement in the mandatory part, once the moratorium has lifted, is that the court will require a landlord to have gone through the program or attempted to have gone through the program and have an actual certificate from the dispute resolution person to the eviction resolution specialist indicating that they have gone through the program before they are permitted to file any kind of eviction lawsuit.
Okay. Well, thank you so much for your time today. That was really informative. I'm going to put the link where people can learn more about this program in the comments. Are there any final closing thoughts that you want to leave us with?
Well, I think I would say that to either party, actually, a landlord or a tenant, but particularly tenants, because the program is sort of designed for the landlord to start the process. But if you're a tenant and if you receive a notice like that, I would just really strongly encourage people to take advantage of that opportunity. It's, as I said, it's designed to help both the landlords and the tenants in particular, though, and to the extent that we can deal with that now, as opposed to waiting until the moratorium lifts and the amount of rent that would be due and owing has spiraled kind of out of control. Let's try and deal with it now, so the dispute will be resolved, hopefully.
Thank you so much for your time today, Commissioner.
Thank you, my pleasure, and thank you again for the opportunity. I really appreciate it.
Let me unmute. There we go. Now everybody can hear me. I was talking to myself here. I said, man, great information there, Nikki, Barron. And, you know, me, Trana and I, let me get it right, I've been talking about this potential around evictions way back to March and April. And, you know, it kind of stays in the back of your mind. It's really good to see people get out in front of this. And for a lot of different reasons, people don't get evicted, you know, landlords get compensated, the court system doesn't get overwhelmed. We're not sending our sheriff deputies out there to literally go and throw people out of their homes. I mean, so it's a lot of positive impacts if people are able to take advantage of this program.
Definitely. And right now, it is not mandatory for landlords to go through the program, but after the moratorium is lifted, it will be mandatory for them to go through this process with their tenants. And I think that's really important, because I think a lot of people are going to be really exhausted from this and just want to get it over with. But this program is going to be a stopgap to hopefully give people an opportunity to engage in finding a solution to a pending eviction and maybe stop it before it gets there.
Right. What else do you have for us today, Nikki?
That's all I've got for you today.
All right. Well, I wanted to take a second here, if you could indulge me and our viewers indulge me, and I want to offer an apology to our viewers and to you. And this is why. And you know, my mama always says, you gotta listen to mama. Mama always says, man, you know, you hop on things early and tell people how you feel about things. And I want to offer an apology here today. We've got a lot of stuff that's going on here in the studio, and people probably see I was in one room earlier and another room right here, and we're trying to record. You know, we do a lot of stuff here at Converge Music, and we've got some musicians over there and some everything else. And I don't want you to think, and I don't want our viewers to think that I've made this show or you or your production secondary. And it's better, I have no problem saying that to you and the general public rather than send you a text later on like, hey man, you know, it's all good or whatever, because your commitment here and what you do and the information that you bring to the public is very much appreciated. And so I want to apologize to you and to our viewing audience for my musical chairs here tonight and moving around here and there in studio. And, you know, people are used to seeing me in one position. I'm used to being in one position. But I don't want you to think that my moving around in any kind of way downplays my appreciation or understanding of how important of a role you play or what this show means to us.
I appreciate the apology. Thank you very much. And we'll see if our viewers accept your apology, but I have a feeling they're going to.
I hope so. Yeah, you know, I mean, the last one I would be looking for, my mom, she gonna hold out. It's gonna be 2-3 days from now. She would, okay. You know, she'd be like, Sunday, I saw your apology to Nikki Barron. I think it's okay now.
I know. I don't even say anything. I have my own producer. Her name is Harriet, so she'll take care of that for me.
The big dog barks. All right, well, man, I appreciate you, Nikki, and you know, we'll catch everybody back again tomorrow on the morning update show at 11 a.m. And then, what is the next time for the coronavirus update show?
So our next topics are going to be, so we'll have it on Monday at 6:15, and we are going to be talking about resources for artists. And we've also got the mental health episode that will be pre-recorded this week, so I'll have that for you next week. So yeah, Mondays, Wednesdays, 6:15 p.m. You can catch us right here, and you can watch all the past episodes by heading to whereweconverge.com, go into our COVID resources page, you'll catch them there, and you can have the episode as a podcast on any of your favorite streaming platforms. I put them up right after we're done here. You can tell because the audio is not all fancy like Bobby makes it, but at least you can listen to it in the car the next morning.
Well, there it is. All right, Nikki Barron, appreciate you.
Thank you.
All right, everybody. Catch you tomorrow morning, 11 a.m. on the Morning Update Show. Until then, peace. You're still live, my friend. I'm glad you weren't doing anything you were supposed to do.
Okay.